Meet our best friend Sam. Sam has cystic fibrosis type 6, a disease caused by the deletion of F588 and G551D nucleotides in the CFTR gene. The CFTR protein regulates chlorine ion movement across epithelial cell membranes. Mutation in this protein causes defective ion transport and leads to mucus buildup. For Sam, this disease affects multiple organs with symptoms mainly including impaired respiratory function and repeated lung infections from colonized bacteria in the mucus. And other CF patients have several treatments. These include airway clearance, antibiotic agents, acute exacerbations, CFTR regulators, and many more. Each treatment has its own disadvantage. The use of antibiotics, for example, may cause renal and hearing damage.
Fibrocal will be administered in an aerosol form using an inhaler. Each dose will restore 89% of CFTR in the plasma membrane. Our novel treatment is Fibrocal, a calpain-1 inhibitor coated with solid lipid nanoparticle. Calpain-1 is a calcium-dependent protease which cleaves NRF1 protein and induces degradation of CFTR. Fibrocal contains cell-permeable calpain-1 inhibitor PD151746 coated by SLN with twin surfactant. The SLNs are loaded with quorum-sensing inhibitor. Fibrocal will penetrate the mucus layer. QSI will be released from the SLN to inhibit quorum sensing, detrimental to Pseudomonas aeruginosa. After passing the mucus layer, the SLN diffuses into the plasma membrane, entering the lung epithelial cells. The inhibitor will be released from the SLN and binds to the calpain calcium domain, preventing conformational change and activation of calpain. Inactive calpain cannot interact with NRF1, hence reduces CFTR degradation. Increased CFTR in epithelial cells causes chlorine efflux, equilibrating water and sodium, thus thinning the mucus. Inhibition of calpain in lymphocytes increases the CFTR and induces production of lung epithelial bicarbonate, promoting antibacterial activity. To determine the half-life of Fibrocal, cells with F508 deletion was cultured with and without 1 micromolar of Fibrocal in specific conditions. Western blotting to estimate the amount of calpain digestion between the control and experimental cells will be performed every hour to detect Fibrocal activity. Sputum samples from CF patients and Fibrocal mobility will be examined using multiple particle tracking. Fibrocal is exciting as it degrades the lung's mucus barrier. Aerosol administration increases the localization of Fibrocal without dispersion and incorrect inhibitions. Biodegradable nanoparticles effectively deliver the drug through the mucus barrier with anti-infectious effects for better dosage. Inhibiting calpain-1 resolves the respiratory issues while not disturbing proteases with pathological outcomes. This treatment serves to lessen the fatal impacts of CF in the lungs, however does not target CF pathology in the GIT. Further caution is required for calpain inhibition in the body and in-data interpretation as murines are simplified models. With funding, future research will allow for human trials to occur whilst improving drug design for selectivity and differentiated targeting of calpain-1 from 2. We are asking $3 million in funding to continue our endeavour in helping people like Sam.